Victoria Amorose, and today I'm going to be presenting my research proposal for our Research Methods course. To begin, my research question is, how does employee education on proper treatment of lower income patients improve patient satisfaction and health outcomes? I chose this research question because I'm a health management major, and I think that through review and looking into other studies that lower income populations are severely underrepresented. So I wanted to see how we could possibly improve their experience and their outcomes in the future. So some research components of this study. The purpose is to perform research to understand if better trained medical professionals in the treatment of low-income populations does have a correlation to better health outcomes and patient experience. So the expectations that I'm expecting to come out of this study are to understand how professional education impacts patient experiences and their health outcomes. If there is an impact, what kind of education would actually impact, and so on. Another expectation is how better educated professionals in the proper treatment of low-income populations does improve patient satisfaction and health outcomes. And lastly, that patients and medical staff will share similar opinions on how low-income populations are represented in healthcare. So some areas of focus, the first is obviously the low-income population satisfaction with their care. So after some review, it was found that patients that identified as low-income earners experienced the following. First being difficulty in accessing care, poor communication with their providers, delays in healthcare delivery, and they were more likely to report poor patient satisfaction as compared to higher income earners. To continue, we're going to be looking into the health outcomes of these low-income populations. It was found that socioeconomic disparities are associated with poor health outcomes, and an increased income reduces the prevalence of health limitations, meaning that those who earn a higher income face less health conditions and poor health outcomes. And lastly, we're going to be looking at the staff level of education. Employee education is specific in patients' needs can actually improve patient experiences and outcomes. And there are some findings that suggest that continued staff education and research improves not only patient health outcomes, but also overall staff performance. So to get into the research design, the method of research that we're going to be using is face-to-face interviews with patients and their corresponding staff. So these interviews would take place in an emergency department, and prior arrangements will be made with the hospital on how these interviews will take place. So these prior arrangements will begin by determining with the hospital when these interviews will take place so that the researchers aren't just going in randomly and speaking with random patients. The interview questions will also be approved by the hospital to ensure patient and staff confidentiality and to make sure that the questions are up to the hospital standards. And we will need to make arrangements with the staff to be interviewed to ensure that the staff is okay with being interviewed, because if a staff member's patient is being interviewed, that staff member will also be interviewed. And lastly, we will need to talk to the hospital about what sort of status the patient needs to be in to be interviewed. Obviously, if a patient is in a critical health status, they will not be interviewed. So we're going to need to make arrangements on what sort of patients can be interviewed before going in the day of and starting research. So the interview process, the first step is that Patient interviewees must be cleared by medical staff prior to the interview. So whatever arrangements are made with the hospital that determine what patients will be cleared to be interviewed, those patients will be asked if they would like to partake in the study. If they do, we will move on to step 2, which is when the researcher will obtain verbal and written consent from the patient. So during this step, patients will be explained how the interview will go and what will be done with the data after. And step 3, the patient and staff interviewees will be asked a formal set of predetermined questions. These questions will give the patients and staff time to elaborate if needed and if they want to. And as far as what medical personnel will be interviewed, if a patient agrees to be interviewed, their corresponding staff will be interviewed. So for example, a patient agrees to be interviewed, their nurse will also be interviewed. And step 4, this kind of goes along with all the steps, but each interview will be recorded and transcribed. So this is just a quick picture of what sort of interview questions they will be asked. So you can see on the patient interview questionnaire, we ask them about their income level, their level of education, because that tends to go hand in hand with their income level. If they have a chronic condition, they can explain what chronic condition they have, and the questionnaire will also go into asking about rating their experience, what could have been better, what needed, why they felt that way. And also, we have the staff interview questionnaire. And this questionnaire is a little bit more basic. It talks about if they have specialty training in caring for low-income populations. If they do, what kind is it? How long ago was it? They can get that chance to elaborate on it. And then they can talk about how they feel that education in this specific population could benefit that patient. So as far as our sampling strategy, this is a convenient sampling because our study participants are not predetermined. We are just going to the emergency room and picking a select patient group to be interviewed if their status is well enough to be interviewed. As far as the data collected, it is quantitative and qualitative because our income level is quantitative, but all the other data is sort of opinion-based and scale-based and not numerical. Here are some references, and overall I feel like this study would just give a good basis in understanding the staff and patient relationship for low-income individuals and what can be done, and if they are actually underrepresented and if they have worse outcomes and experiences. And I feel like right now with the pandemic, this would be an amazing time to see how low-income populations are actually being impacted by healthcare.